All right, guys, we are live. Let's see, telling followers that you are live on video. I will wait for a few people to show up. Okay, good. We have some people. Hey there, happy Sunday. What's happening, guys? We got a group going. I cannot deny that I'm a little exasperated and out of breath after last week's debacle of falling in and out of service. Of course, I wait till the last minute to check my Wi-Fi connection. And of course, my Wi-Fi connection is like not working well at all. So I'm scrambling in my basement. I'm plugging in, unplugging things. I'm screaming at family members. I'm screaming at my dog. Why isn't this working? Iggy, help me out. And then I'm telling everybody to get the fuck out of my way. So I have to calm down. I have to drink a glass of water. I'm here with you. And speed test says it's all working okay. And yeah, happy Sunday. I got no specific beauty news. I've learned some lessons. I've achieved and received some constructive criticism from last week. And what I'm going to do with this live is I'm going to give my spiel. You know, I always give my spiel. And then I'm going to answer questions from the audience. Obviously, we put a little post up and I received a lot of questions. I put them all on paper, and then I'm going to hand it over to you guys on this little list. Oh, I'm so happy so many of you are joining. I could even wave to you. Anyway, so I'm going to try and be relatively organized about this. I'm going to give my spiel. I'm going to answer your questions. Then I'm going to answer your live questions. And then when this is all over, if any of you get bored with me, and I'm going to be shocked if most of you don't get bored with me, we're going to post this live because now we can post it. And again, if I work these things right, everything should go well. Happy Sunday to you. So what are we talking about? Let's get to the point, Dr. Frank. Emface, it is here. I am so excited. You know I love my toys, and you know I love Emsculpt technology. You know I work with BTL Aesthetics, the company that brought us the original Emsculpt, and I've been working with them for, almost a year now in development of it. I've kept quiet. I've kept my cool. I haven't spoken to media without really, I've kept it under wraps, and, I get so excited about things. And now it's here. It was launched on Saturday, so now the floodgates are open, and I can talk about Emface, and you can bet your ass I've been practicing with it for quite a while, getting our protocols down. We are always at the hottest new technologies here first at PFRANKMD. And I have a lot to say about it. So for those of you out there, let's first talk about Emsculpt technology. Emsculpt technology first came out in 2018. It was the first device that affected muscle development. Now we know so much of our health and so much of our aging is muscle tone, right? It's not just change in volume. It's just not loss of collagen. It's not changes in elasticity. It's our bone structure. We haven't figured out a cosmetic treatment for bone yet. Stay tuned. The first groundbreaking technology that affected musculature was obviously Botox, right? Neuromodulators. Hey, all right, I don't know. I spoke way too soon there. I went off grid. I lost connection again. I don't know. I'm just going to keep walking around my house and answer all these questions. Anyway, it started in 2018. Botox was the first muscle-related treatment, and groundbreaking as it was, started in 1985 and eventually progressed to an FDA-approved, the most common groundbreaking treatment ever for cosmetic treatments. Oh, I'm going to sit in my basement here. This looks pretty good. Look at that. All right, so we're here together in my basement. But it took until 2018 until we were able to make waves by developing muscles rather than weaken them. And this has been the thing. Botox has been around FDA approved for 20 years, but it has always been a little counterintuitive that we're weakening muscles, right? As we get older, every muscle on our body weakens. Our skeletal muscles, our facial muscles, things sag. Every part of our body sags. And there's so many reasons for that sagging. Well, one of them is muscle laxity. Now, the muscles in the body and the muscles in the face are very different. I'm going to get into that. And although using neuromodulators like Botox and Xeomin and Dysport and Juvo and now Daxxify, which we talked about last week, have huge cosmetic benefits, they are clearly not the answer. And we are currently in a world where injectables have made such a groundbreaking landmark difference in the way we treat aging for the last 20 years. But clearly, this is not the only tool. And treatments like Emsculpt have really changed that. Now, what was it about Emsculpt that changed the game? The original Emsculpt was electromagnetic field technology, okay? It was similar to an MRI, and what it did, this was a proprietary technique specific to them. Every other company that made these devices were just weaker E-stim devices. The electromagnetic energy targeted the muscle nerve route and stimulated the muscle in a way that you could not do voluntarily, okay? You were able to do 20,000 sit-ups in a 30-minute treatment. You were able to develop muscle, and then soon after that, with the addition of radio frequency, we were able to add skin tightening and fat melting technology. So Emsculpt really changed the way we did everything, and still to this day, and went to the buttock. We started doing calves, we started doing everything, and I know every patient of mine for the last 4 years said, Dr. Frank, when are we gonna do this for the face, right? And I always said, you know what, the face is a different animal. Skeletal muscles and facial muscles are completely different. You cannot build the muscles of the face like you do the skeletal muscle. You can't do the, everyone's doing facial exercise. You can't build the structure of the face like you would your biceps and triceps. But we knew that Could people see me? Let's see. All right, okay. So, what happens is there's so many different things that are addressed when when people go for facial plastic surgery. They're adjusting the muscle plane, they're adjusting the fascial plane, they're adjusting the skin plane. But up to date, there really is no technologies that really address those deeper layers of the face. We know topicals can only go so deep, right? We know that peptides, collagen stimulators, retinoids, they could really only do so much topically. We have learned in the last 20 years that injectables could only do so much, right? Where eventually injectables, particularly Botox, become a law of diminishing returns, right? As time goes on, it not only seems to work less, but it could actually be a detriment to our facial structure. Same thing with fillers. A little bit of replacement of volume goes a long way, but after time, you're really just stretching skin in the loss of elasticity. We do have skin tightening agents out there, therapy, Axillus, Thermage. We have all these technologies that work to tighten skin, energy delivered microneedling, Morpheus, Vivace. There are so many products out there, but what are we doing for the deeper structures? Okay, so now I'm getting to the point, guys. Now I'm getting to Emface. Now, Emface is not the electromagnetic stimulation of the original technology. They tried that. But the power of electromagnetic field technology was so strong that it literally was like traumatizing the muscles. It was just contracting too much. The quality of the muscles in the face are much thinner, they're much more delicate, they're much more intertwined. So they went back to the original rehab technology, rehabilitation technology that this BT, and anyway, okay, I got you back. I'm not hearing from any of you to let you know if I lost you or not. Anyway, the E-stim technology that was used in this, they had to perform studies in order how to synchronize it to increase the baseline muscle tone. Because clearly, just, when you would say, why not just do facial exercises, right? Why not just do that? Well, it's been proven with this technology that if you deliver synchronized electrical energy in combination with radio frequency technology, that in the strength of muscle strength of the face, not in contraction, right? Because it's that basal line muscle holding up our face. So the goal of Emface technology is to really target this baseline energy in combination with the radio frequency, also improve skin thickness, improve collagen. The Emface is performed, it's a 20-minute treatment. There are 2 pads. One targets the frontalis muscle, one targets the zygomachus major and zygomachus minor. These are the 2 muscles that control smiling, and like when you look in the mirror and you're feeling old and you just go like that, that's what that's targeting, okay? I hope the neck is coming one day, but for now, we're talking mid-face, frontalis muscle for brow lifting. By treating this area, we are lifting the neck and the jowl area, but not the lower neck. So the treatment is performed 4 treatments weekly, 20 minutes. It's not painful. This is one of the questions. You apply these things to it, you feel heat, and it's you kind of laugh at first because it's kind of making you smile and making you raise. Yes, you can use it if you have Botox and filler in the face, because again, it doesn't affect the voluntary contraction. You're increasing the baseline muscle tone at rest, because even at rest, our muscles are contracted 40%. If you paralyze them, it stretches the skin like Botox and it decreases it even more. But this is about increasing the baseline muscle contraction. Now, you do see the results quite quickly. Like any workout, you're seeing the result right away. People would ask me, what is the difference between this and the electrical current stim that an esthetician does? That is not specific. When you get the electrical stimulation that an esthetician does, it's a generalized thing. It's not going to specific muscles. It's not synchronized. It's not coordinated with RF. And it's just a generalized kind of stimulation of the muscles. It does have a temporary response when you do that, but it does not have a permanent impact. Certainly not one that's been studied and has received FDA approval. And they went through, I mean, believe me, we wanted this machine out a long time ago. This has been in development for quite a while, but it took the time and the energy and the research to prove that it would have its longevity as good and as demanding as the rest of the BTL products. So what was my point here? The point is that the esthetician electrical stimulation, the electrical current, is really just temporary. This is providing a long-term baseline thing. And you can compare Emsculpt technology the same way to those eStim pads that people get on Amazon. They are not the same. These are clinical devices that have been thoroughly studied for safety and efficacy and proved to have a clinical effect and safety well beyond what you're going to get on Amazon and esthetician's office. Someone's asking major difference between Emsculpt and TrueSculpt. Well, Emsculpt is more for muscle, TrueSculpt is more for fat. So, I gave you the basics of what this is. I'm going to go over some of the questions I have there. People are asking me to compare this to threads. Threads shift tissue. That's all they do. They shift skin. They do nothing to the undersurface. Listen, I don't believe that Emface is going to replace facelifts. I don't believe it's going to replace injectables. It is going to be an injectable sparing technology. It is going to allow people to become less dependent on injectables. They're going to replace them. And ultimately, that are willing to do this in combination with several other treatments. It may stave off the need for a facelift. It requires I still think threads are a great thing. Will Emface melt fat? No, it will not melt fat. And I got to tell you, in general, most devices do not melt fat unless they're done totally irresponsibly. So this should not affect the volume of the face at all. It will not affect the Botox or filler you have in your face. It will not melt the filler. It will not destroy your Botox. There is something to be said about whether or not it will make your Botox wear off quicker. That I don't know yet. We have to pursue this. As far as I know, I have not seen this yet, but now that it's mass released, I will let you know, because I've certainly done it a bunch of times. It has not affected my Botox yet. Okay, even though as we get older, I like to use neuromodulators to keep faces moving, right? We want to keep faces moving. Pain, this is not painful. It could be painful, like with Emsculpt, you are given a nurse provider that is going to follow you closely. This is not a machine that you just turn on, you place the pads on and you let the patient stay in the room by themselves. You do need a nurse in the room. Every 5 minutes they're making the adjustments, making sure the heat is palpable but not intolerable, making sure the contractions are effective but not uncomfortable. And like any workout, you build up over the time, not only with any treatment, but between treatments. How many treatments and what's the cost? Of course, I'm going to get to this. It's 4 treatments. We don't know the maintenance yet. I assume like Emsculpt, people will want it. If they love it, they'll do it a few times a year. This is also going to depend on your age, whatever treatments you're doing, what your end result is, what are the risks. You have to be cautious, like with Emsculpt, the people with metal in their body, screen them out. I have dental implants that are titanium. I have not had a problem. The company recommends doing it if you have metal in your mouth or your body. You do have a radio frequency grounding pad behind you. So, again, if it hurts dramatically during the procedure, you stop. But I don't know of any risks or any patients that have had problems. Let's see, comparing this towards a facelift, this will not be a facelift. You do see some lifting, you do see some long-term improvements, but again, this is hopefully to stave off the inevitable, but it's not going to replace it. Does it affect the jowls? Yes, it does affect the jowls. The zygomaticus major and minor that you're affecting here, if I take my finger and go like this, see how it just like lifts that area up? That's exactly what the Emface is going to do. So it will help the jawline, it will help the other neck. It's not going to do this, guys. I'm hoping that we'll see some technology come out that will advance with Emface. So stay tuned for that. We may even be working on it as we speak. How long does it last? It lasts as long as you put into it. Again, age, what other procedures you're doing. I think the results are long lasting. But there's always going to be maintenance. My Emsculpt patients love coming in for it. They come in for a few times a year, some patients once a month, some patients once a year. And I think it will be part of your maintenance. There is no treatment that is one and done, or you do a series and it's all over. So we're certainly not going to see that with this as well. When's the neck treatment coming out? We don't know. Maintenance treatments, we just talked about. Combination treatments. 100% of the patients I've done this on so far do it as combination treatments. I've certainly done it myself. It combines well with injectables, skin tightening. I mean, listen, it takes an army to keep us looking good, right? There is no one defining aspect of aging, right? It's a skin issue. It's a fat issue. It's a skin barrier issue. It's a muscular issue. It's a bone structure issue. So we have to attack it, and I always find the best results come from a combination of small things. Combination of small things make big changes, and I think Emface is a relatively risk-free, time, cost-effective, and a device that actually gets to the root of the problem. Loss of elasticity, loss of collagen, loss of baseline muscle tone that supports the architecture of the face. This is what Emface is doing. It's optimizing the architectural structure of the face. And again, like what I saw it do for the body, I'm expecting it to do for the face. And wow, that's my list of questions, guys. Do any of you have questions out there? I'm sorry I've been going in and out, but cost. I did not answer cost. I don't have any filters on, but I wish I had one of those weird filters because I hate talking about cost. But again, like the Emface technology, depends where you go in the country. It could be anywhere between, $3,500 and $4,500 for a package, something like that. Obviously, maintenance treatments and larger packages are going to be easier. I do think there is a skill to this, like with the Emface technology. I've had a lot of patients come to me where they had bad results, not good results from Emsculpt, and it was definitely in the manner of which it's done. They didn't have someone skilled in knowing how to gauge the treatment, how to place the things properly, how to build the patient up, get the feedback. There is a skill to this treatment. It's not just slapping pads on the face and doing it. There is going to be a price range. I do believe that you do get what you paid for. I know in my own practice that we sell packages. We call them like Emsculpt, Emface gym memberships, so that people will be able to treat multiple areas, buttock, abdomen, arms, now the face, and they can get significant discounts. If you have implants in your body, would Emsculpt be a contraindication, as long as it's done in a different area? If they're metallic implants, honestly, they say it's a contraindication. If they're titanium, I see absolutely no reason why it can't be done, particularly if it's at a distance from the face. Patients where we've been concerned, we started at a very low dose of energy and we go up slowly. If they don't feel any pain or electricity or heat in the area, then it's totally fine. Again, this is why this is not a spa treatment, kids. It needs to be performed by healthcare professionals. You get what you pay for. It's a 20-minute treatment, but you're going to be in that office for 45 minutes, an hour until it's get done, because you do have to take it cautiously and carefully. So yeah, $3,500 to $4,500 for a package of 4 combination treatments. Ask your provider if they do packages with other Emsculpt and Emsculpt Neo treatments. Like the Emsculpt Neo, this is a combination of radio frequency and E-stim. You know, they call it HIFEST technology, high intensity focused electrical stimulation. And, you know, the relationship between the electrical stimulation and the radio frequency, they're not separate entities. The radio frequency definitely boosts collagen, thickens skin. The electrical stimulation separately, definitely it's what's doing the heavy lifting on the muscle basal tone. But they synergize each other. I have titanium clips in my bowel. Is this still safe? Again, if they're titanium, I see no reason. Test it out. Obviously, the facial treatment is far enough away. I don't see why it would be a problem. You have to ask your healthcare professional. I would do a test. You know, I certainly turn on the machine for patients and do a test at no cost to make sure they feel safe with it. This includes as particularly dental implants. A lot of people have bridges or dentures, things of that nature. I do think a lot of the quality of this technology is going to have to do with age. You know, patients, I think this is going to be great for younger people starting out. I certainly think that one of the biggest problems in my field right now is that I see way too many 20-something-year-old people with a face full of fillers, totally frozen faces. I'm really concerned about the future of injectables with young people. I think this is a great technology that's safe and effective and that will not change the natural structure of the face for younger people. Any young person that comes to me and says to me, what could I do to help minimize the process of aging? What treatment should I do? I say sunscreen, Emface, and retinoid. That's pretty much it. Certainly there are places in the 20s where a little bit of injectables, a little bit of Botox. I mean, I started when I was 27 with Botox because I had lines there. There is a place for injectables and skin tightening treatments. But, you know, here's a good one. Post facelift, 3 years, my jowls are coming back. Absolutely. I think this is a great treatment for people that have maybe had prior surgery and are redraping. Right? The muscle loose. Facelifts only last 10 years. Anyone says that, any doctor that tells you it's permanent, one and done, again, not even facelifts last forever. So like when I do all therapy for people who have had facelifts or when I reintroduce injectables, I do believe Emface is going to be very helpful for people that have surgery. I do the same thing with my face tight treatments. This is the exact same thing for Ellacor. Ellacor is great as well for people that have a little bit of loose skin, either prior or after surgery. What do you think of a mini Botox? I have wrinkles in between my eyebrows. Listen, neuromodulators like Botox have the monopoly on muscles of hyperexpression. Emface isn't going to get rid of it. Fillers aren't going to get rid of it. Facelift, only neuromodulators. But there is such a thing as too much of a good thing. Will Botox hold shorter if using this? I do not believe it will. I can tell you from personal experience, my neuromodulators, I have not found them to wear off quicker. Is it possible? It is. You know, when you do the Emface, it's not affecting the course. So I can tell you right now, it will absolutely not affect the wearing off of the glabella or the crow's feet complex. The question is, does it affect the frontalis? Because it's the frontalis muscle is directly affecting. Now, I will tell you from personal experience, I've been doing Botox in my forehead for 20 years. It is a law of diminishing returns. As you get older, the frontalis weakens without Botox and you get a heavy brow, okay? And you get to a point, trust me, I've lived through this, where the Botox just doesn't work, and if it does work, it just makes you heavy. And then you end up in a position like me where you want to get your eyes done or get an endoscopic brow lift, which I have had done, for many of you who don't know that. So I've had work to repair the muscle there, because I've always had a concern that over-injection, or not even over-injection, just injection of decades of Botox in the frontalis muscle permanently weakens and exacerbates the aging process. And that's my concern with injectables. There's nothing wrong with injectables or any treatment in small amounts over time. But there is a point where all good things can become abusive and be a detriment long term. And this is breaking, right? I wish Emface was around 10 years ago when I started getting heaviness. I wouldn't have needed the muscle repair that I had. And yes, now I can use Botox again in my forehead. But as you see, I still leave an enormous amount of motion, because motion is normal. It is not normal, people, to freeze your muscles. Period. We can neuromodulate and we can soften your wrinkles, but it is not natural to freeze. When people say, I don't want to move my face, I won't do it. It is not natural to the aging process. It is a detriment to the aging process. And what I want to do is help people age gracefully. And yes, taking care of ourselves, using deodorant, brushing our teeth, combing our hair, showering, using soap, maybe doing a little Botox and filler. These are all things that are going to help us live healthier, better groomed, and hopefully better looking lives. But I have to be very cautious, because I've been doing this for 23 years and I hope to be doing it for at least another 50. I have to help us all figure out ways on how to balance it, and making sure too much is a good thing. So I'm not throwing out my Botox needle, not for myself or my patients. I'm going to continue using injectables, but as you all know, I am a technology freak. Do I do lipo? Of course I do lipo. I just haven't done it on myself. It's one thing that God blessed me with. I have pretty good metabolism, and working at it, I can control my body shape. But I do use Emsculpt on the body, right? You see me show it off. When I go on vacation, I want those extra abs. I'm doing some Emsculpt treatments. I'm not afraid to share the things I do to be the best version of myself. I do everything I can at home, taking care of myself, eating right, keeping the toxins out, but you could bet your ass that I'm going to do the things within my power in my office to take it to the next level. The trick is the balance, to know what is going to be in your best interest. What do you think of Botox or injections for HA? I don't understand that. Hashimoto's disease, there's not a problem with that. Do you do droopy eyelids? I do not do surgery, but I'm hoping that Emface will help lifting it. Am I against surgery on the neck? I am absolutely not against surgery. I love sending to my plastic surgery colleagues. Dr. Rosenberg, Dr. Giacono, I aim to keep them busy, because there's a time where everything becomes a law of decreasing returns, and I have to sit patients down and I have to say to them, it's time to have that discussion. Because when patients come back to me and the things that I've done on them in the past are not doing or making them happy, we have to reevaluate. Sometimes you have to, I'll explain Emface again in a second. Sometimes we have to accept the aging process. Sometimes I have to change my goals and either use more of the same thing or change devices or things like that, but sometimes we have to consider surgery. So just sort of a review out there, we're talking about Emface, synchronized electrical stimulation with radio frequency energy to hyperstimulate the muscles of the forehead and the face to increase baseline muscle tone and support the architecture of the face, much like we would accomplish with surgery. Hot new technology used as a naturopathic means to optimize the architectural structure of the face, okay? Can it slim chubby cheeks and define? No, it does not affect, that's a great question. It does not destroy fat, it does not slim face. The energy levels and the manner of which it is synchronized in the face is different than it's done in the body. So it is not going to melt your face. It won't slim out your face even if you want to. Difference between Emsculpt and Vivace. Vivace is a superficial treatment. All microneedling treatments, Morpheus Vivace, are for the epidermis and dermis. They don't do anything for the fat. They don't do anything for the muscle. They're great in combination. Is it okay to use for thin-skinned people? Absolutely. The goal of Emface, part of the goal is to thicken the skin. Is NuFace effective? Great example. NuFace is one of these e-stim devices, like what you get at the spa. They are very superficial, very broad. They may give a temporary several hours of a little lift. They do work, but they're certainly not going to have a long-term or clinically significant effect, okay? I did neck threads, did not work. I'm sorry about that. Hopefully it wasn't with me. Again, all these treatments are defined for the right patient. Emface may not be for everybody. Threads may not be for everybody. All therapy may not be for everybody. I try and take every patient that comes to me. The good thing about me is that I got all the toys. And I like to be as honest as possible, because if you go to someone who only has a hammer, they only have like 2 lasers and do injectables, or even worse, you see all these people, they only do injectables. You go to these med spas, they only do injectables and like 1 machine. They're not being honest with you. They're not giving you the options. They're not giving you the benefits. They're not giving you the full spectrum, right? Everybody is different. There are certain consistencies in the way we treat people. But you have to have the full tool chest and be with someone who's going to choose the right technology for the right concern, for the right age group. And listen, the option is always to do nothing. There's nothing wrong with doing nothing. But if you are going to do something, it has to be safe. It has to be effective. It has to meet your expectations relative to the safety and efficacy. Some people only want to do totally non-invasive. Some people only want devices, don't want injections. Some people only want injections, don't want devices. Some people don't want anything non-invasive and they only want surgery. We have to read the patient and we have to have the full spectrum. I know what's within my level of expertise. I know when it's time to refer out. And I know when it's time to sit down and have that conversation to a person to make sure my goals, their goals, and both of our expectations are met. This is the summary, kids, because I'm going to get off and I'm going to go about my Sunday and leave all you too. This is the summary. Emface technology is a brand new, groundbreaking technology that I really do believe, like Emsculpt was for the body, the first of its kind to really target one of the most important causes and results of the loss of the natural, youthful architecture of our face. It affects muscle tone, it affects skin tightness, and these are 2 of the most essential things that degrade as we get older. And although there are so many other great things in our armamentarium, from injections to skin tighteners to microneedling devices to resurfacing agents to other deeper lasers to now microcoring, fractional microcoring, although there's so many other things out there, there's no one technology's got to be great. So when I see something groundbreaking that does something in a different way than any device before, like Emface, you know what I do? I tell you guys about it. And we have it now. We are glad. I'm psyched to really be one of the first people in the country to have this. There is no wait. We have been using it. I am using it, and now I could share it all with you. I'm open to your questions. I'm going to post this, and I hope to see you all in my office and continue the journey. I thank you all for joining. As always, I don't know, I have to hire an IT person so I could either fire them or get angry at them, because I have no one to blame by myself. I keep checking all these Wi-Fi things. It seems to be working now. I'm really sorry. I am going to get better at this. But I feel pretty confident about what it's going to be like when you come to my office, so I got that under control. Have a great evening, everybody, and I will see you this week. Peace!